Mr. Collins, I want to thank you and I want to thank my colleague from Iowa. This is a bipartisan issue. And before I speak on behalf of the community pharmacists, I want to just take a second and speak on behalf of the taxpayers, the hardworking men and women in this country. You know, free markets are transparent markets. And if we had transparency in this system, we probably wouldn't be here today because the American public wouldn't stand for what's going on. Unfortunately, we haven't seen any news reports or any reporting to inform the public of all of the things that have happened over the last couple of years. But we saw it on the EpiPen just a couple of weeks ago, and you saw what happens when the press reports, the public finds out what's going on, pressure is put on, and then a response comes. Maybe not the response that would have been what we would call equitable for the patients that need the treatment, but at least a response came. It's not just EpiPens, though. It's not just multi-$100 drugs and multi-$1,000 drugs. When we talk about drugs as simple as nitroglycerin tablets, and again, you as the taxpayer are the largest purchaser of this through the government. Nitroglycerin tablets have gone from 5 cents a piece to $5 a piece. Doxycycline tablets, an antibiotic that's been on the market for many, many years, again, another generic drug, it's gone from pennies a piece to dollars a piece. I know my colleague Buddy Carter could probably name more drugs for you than I can, where we've seen those same type of hundredfold increases in the price of drugs. And I can tell you that you as the hardworking taxpayers of this country, in the end, pay that bill. And so one of the best things that we can do for you is to make sure that we are trying to shed light on and bring transparency to this system, and to make sure that we are keeping that small business owner in business so that we're able to get the information that we need to do a better job for you from them. And that's where our nation's community pharmacists come in. I know for me, I walk into my local pharmacist and they can tell me right offhand, you know, what the most egregious price increases were of the past week. And they're happening every single week, ladies and gentlemen. These independent businesses, they operate in underserved or rural areas like many of the counties that I represent in Georgia's 8th District. Access to care is already an issue in these areas, and it'd certainly be much worse if our community pharmacies didn't exist. These areas, doctors are many miles away. Local pharmacists deliver the flu shots. They give advice on everything from over-the-counter drugs to drug interdictions. And if you've got a sick child, most of them will meet you at the store after hours to help your child get the medication that they need. Try that with somebody who's not a small business owner. It's crucial that these pharmacies have a level playing field to stay in business against the large-scale competitors and the middlemen, if you will, the pharmacy benefit managers, when trying to run a successful business in such a challenging and complex environment as the U.S. healthcare system. Where I'm from, these local pharmacists, they're fixtures in their communities. They've known their customers most of their lives, and it instills a level of trust in those patients that's rarely seen in today's day and time. I make stops at these local community pharmacies, some to get my own prescriptions filled, some to see how things are going with small business owners, some to see how other things are going in the community. And I never fail to appreciate the unique value that the men and women that work in these local pharmacists add to their customers' lives and to our communities. Unfortunately, on these visits, I'm also troubled because I continue to learn, as I've mentioned before, just how much more difficult it is becoming for those men and women to serve the people who have depended on them for years and to compete with some of the larger entities in the healthcare marketplace. Imagine a situation where your competitor's company gets to come in and audit your books. That's exactly what happens. That's exactly what happens when one of the big box retailers who owns a PBM goes in and audits the local community pharmacy. Take, for example, one of the other problems that we have, the increased prevalence of preferred networks and Medicare Part D plans. Currently, many Medicare beneficiaries are effectively told by pharmacy benefit managers, or PBMs, which pharmacy to use based on exclusionary agreements between those PBMs and, for the most part, big box pharmacies. Most people don't recognize that the big box owns the PBM. Patients pay for this. They pay for this in lower customer service and higher copays. When their pharmacy of choice is excluded from the preferred network, it creates undue stress on the patients and forces them to do business where they may not want to do business. The majority of the time, your local pharmacy is never given the opportunity to participate in the network. Now, that's an unfair business practice. Another issue I often hear about from community pharmacies is the burdensome DIR fees. You know, we as Americans, we pretty much assume that when you go in and you buy something and you leave with what you pay for, that the transaction's over. But with medicine at your local pharmacy, it's a lot different. That transaction is anything but clear and simple for the pharmacist. Pharmacy benefit managers use so-called DIR fees to claw back money from pharmacies on individual claims long after the claim has been resolved. It can be a typographical error, and the pharmacy benefit manager will claw back 100% of what was paid to the pharmacist. That means the pharmacy doesn't know the final reimbursement amount they'll receive for a claim for weeks or even months, and even more so, they're not even reimbursed for the wholesale cost of the drugs that they dispense. In 2004, CMS issued proposed guidance that would provide some relief to our pharmacies struggling to deal with the increased and opaque DIR fees imposed upon them. As I said, anyone who runs a business knows you can't operate when you don't know what your costs are or what your reimbursements are. That's why I've led over 30 of my colleagues and sent in 2 separate letters to the Center for Medicare and Medicaid Services urging them to move forward and finalize proposed guidance on this issue. Unfortunately, they're yet to move on that guidance. As I know many of my colleagues, in a bipartisan manner, are going to continue to advocate for CMS to use their authority to ensure a level playing field for all Medicare Part D participants. When competition is stifled and our small businesses suffer, so do the customers of our local community pharmacies. I hope the committees of jurisdiction will consider these bipartisan bills. Mr. Speaker, I want to thank you for your time. I want to yield back to Mr. Collins any remaining time, and I want to thank him for hosting this special order today.